advantages of other technologies. So though diode was considered as the gold standard,
Right.
and you have also given us the reasons why this technology is better.
Right.
And more than what you heard, the practical experiences of a man who is using these technologies for a long time matters. So if you have any queries which really matters to be learned, please ask Dr. Satyendravan. He will be more than happy to answer that. Any questions, please?
I'm Dr. Sumita. I'm from Hyderabad. I just wanted to find out if you have any experience of use of hair removal machines or hair growth in a keloid area. Will the parameters make a difference? I mean, we do come across people with keloid and hair and having folliculitis or infections or abscesses.
Personally, Civic ma'am, I haven't used a laser hair reduction machine on a keloidal area, but I don't see a reason why it should be any different from the typical conventional.
I mean,
levels that
considering
we
the
use.
thickness of skin and the depth of penetration is not similar to the normal skin would have, you know. So
Since hair shaft is the main portal of entry
Yeah.
over here, so I don't think there'll be any difference.
I mean, the depth of penetration of each light beam would be different, isn't it? So
Yeah, but the conduit is the same. So through the hair, it will be absorbed inside. So
Okay.
there shouldn't be any difference. But practically, I haven't had the experience, so I wouldn't be. I'm not the best person. I'm sure there'll be other people who would have tried that, but I haven't tried that. But I think it'll work equally well. There
I
shouldn't
think
be a problem with
she has a practical problem there. It's a very common problem, particularly over the chest, where the hair goes through and it gets infected. And what he is telling also is very practical, because you do not know unless you try and do it. So one has to try and see whether it works, because what you are asking is sensible, that is it possible to penetrate that much depth. But the technology is that if once you heat the hair, it is transmitted lower down to the bulb bundle. So it should be able to work, but we do not know. Till now what we are doing is we have been advising the patients to pluck it and apply some amount of topical antibiotic and clean the area so that it doesn't get infected. Somebody has to try and say, Rajendran is the best person to try everything and tell us.
I had one more question. What is the least age when do you start using hair removal for children?
The recommendation is that you can start 2 years after reaching menarche, or by the age of 15 years, whichever is earlier. So that's what I follow typically. Yeah, the skin is very soft, and the hair growth has not really reached its full. So you would miss out certain hair follicles if you start doing the treatment very, very early. So that is the reason.
But I don't think anybody will reject any patient irrespective of the age. It's a fact that the hair will grow only after the puberty, and having invested so much when they come, you will naturally do it.
No, that is not the reason. I have patients who are, who perform on stage like young girls,
Right.
Bharatanatyam. They have a lot of hairs. They do come for hair reduction. So we do hair reduction,
Right.
and followed by efflorethin just to maintain it. Because they are psychologically affected when they have hairs when they go on the stage, because a lot of video focus is there and thing. So pertaining to the age, there is no any this age we should do, but depending on the situation you can do the hair removal. It all depends on the situation.
Regarding that keloid, and it's almost akin to managing a pilonidal sinus, because we do get references from surgeons too. Now here the main problem, one is the presence of infection which needs to be tackled, just like Dr. Reddy told. And considering the local distorted morphology, the root may be placed in a different way. So the same machine I do use, but I use a higher fluence. I tell the patients that this is likely to be pain. And instead of the stack mode, I go for a continuous mode and shoot. There may be a little of discomfort to the patient, and we may need, instead of 5 sittings, maybe about 8 sittings on a monthly basis. I think we can achieve over there. And regarding your question number 2, like usually it's better we wait for about say 2 years after they attend Menarche. Because one thing I've seen is when we do laser on a vellus hair, very often some girls tend to have fine vellus hair on the sideburns and in the upper lip, and very often they'll be a bit long also. I've seen a paradoxical growth later. Like these vellus hairs may turn terminal pretty fast after about 3 sittings. Then they become real candidates for a laser removal. So I always tell the mothers, one is not to be in a hurry. If possible, go for a home bleach also. That would be ideal. But if they still insist, okay, fine, we have to take the risk.
Besides, sir, these days patients are very, very aware. So medico-legally also, if you start the laser hair reduction at a very early age and you end up having paradoxical stimulation of hair like what you mentioned, then you'll be in a soup. So I tend to play it very, very safe that way. But if somebody who's very well known to you and who insists that they want to start telling them all the positive and negatives, if they insist, then I start, not otherwise.
Yeah, I have one question here. What is your experience about the length of the hair which keeps on growing post laser? The hair becomes fine. From terminal it becomes vellus, but the lengthwise it keeps on growing.
It does, especially in the jawline area and under chin area, it tends to keep on growing. So then in that case, I sometimes use the traditional hair reduction laser also. I do double pulsing. And
so with what, Nd:YAG or?
No, in my machine I also have the diode, which is the traditional diode laser. So I do double pulsing with that. That has some impact, but still the length keeps on growing in some people. And I ask them to clip them and come in for maintenance treatments frequently, probably every 3 months or 4 months.
Because sometimes it's not acceptable, it becomes long like a beard.
This is a practical problem that is there in every laser, sir.
When such situation come, actually if you look at it, now the trend is for hair removal.
Right.
Now we had diode, long pulse.
Right.
Now there are machines which are coming with dual technologies.
I wanted to ask.
So sometimes if one technology is not working, you should go for another technology to work on that. I think definitely you can achieve that.
Actually, I wanted to ask that specifically. Yeah. What is the specific advantage of using two technologies? For example, either this or diode with long pulse Nd:YAG. Some of the deficiency with each of them can be addressed there, because we really do not know sometimes how this works, how that doesn't work. There are still some questions which are unanswered. So already some people are doing it, combining the technologies alternatively. Like once either diode or super hair technology, and next alternatively with the long pulse. I think both of you can answer whether what is.
I think I do a lot of patients with diode and IPL together in the same session. I do an IPL, I do a diode followed by an IPL in the same session. It can be done with the difficult problems, because I have come across patients who are coming with this problem, and it helps. But now there are companies, now they're thinking to introduce two technologies together in the same platform. Okay. So now it is going to come as the time is going to come, two technologies. Already some companies have introduced that. And in fact, Alma, we have 3 technologies with us. One is long pulse, SHR IPL, diode. I also have a Q switch, that is a Medlight or a Q switch of Alma also you can use for hair reduction. And also you can use the long pulse Nd:YAG. So you can use you can combine the technology, or you can change over the technology also.
Generally speaking, sir, I've seen that having used the 3 technologies, if one is not responding to one technology, it's unlikely that they'll respond to the other one, generally speaking. There will be some people, probably 5%, 10%, who will have a positive response if you combine technologies. Like I also combine sometimes the SHR and the conventional hair reduction. In the same session I do it. And I do find that in some people there is a better response out of doing the 2 technologies together, the SHR and the conventional diode laser together. But
there was an article in the Yearbook of Dermatology 2007. In fact, the original article, I could not get the full article. Right. They are told, especially in paradoxical hair growth and thing, they used metformin in patients with polycystic ovaries when they have lengthy thing. Metformin and hair removal are augmented or given a better results with the patients. Okay. I really do not know how this oral drug along with the laser has helped.
In some women, I do tend to add finasteride, 5 milligrams, especially people who have completed their family. And that itself has a pretty positive response. Even if the DHT levels are normal, if you add finasteride, it has a positive impact that way. That's what I do.